Let's talk about faith and mental health. I am a clinical psychologist. I'm also a person of faith, and I often get asked how faith and mental health can fit together or how they work together. For some, actually for many, it feels like they're in conflict or there tends to be a lot of tension when discussing these topics. There are a few misconceptions that I want to highlight. One is that if you have faith, you should not struggle with mental health. That is not true. There are a lot of people of faith that do struggle pretty significantly with different mental health related challenges, and there are not in any way inferior to people who are not struggling right now. Faith is helpful, it is amazing, it's powerful, but it does not make you immune to being human. So while we're living in this world, we will experience challenges, and some of that might be mental health related. The other misconception is that prayer alone should replace therapy or any form of treatment, and I also don't agree with that. I think in the same way that we would go to a physician to address any physical illness or physical pain, it's helpful and very productive to go to a mental health provider to address any mental health related challenges. Another misconception that I hear from the other side is that there is no room in psychology for faith or spirituality, and that's also not true. There's a lot of research showing that for many people, faith is an incredible source of resilience, of hope, of connection. And so the reality is that faith and mental health can work very well together. You don't have to choose one or the other if you're a person of faith. So you can pray and draw strength from scripture and community, and also use therapy to process grief or trauma, practice different calming strategies if you're struggling with anxiety. Also learn different skills to change your thought patterns and behavioral patterns. So you don't have to choose one or the other. It is important that we use whatever services that we have available in order to live a whole and productive life. And so I don't think the question should be faith or psychology. I think it could be how can we use whatever resource we have available in order to heal the whole self, right? Soul, body, spirit.